We're back with Meadow Feeds exploring the science behind making feed. This week, we're joined by Wihan Kitshoff, Ruminant's Technical Advisor at Meadow Feeds. Wihan, great to have you with us here on Farmers Inside Track. Welcome.
Thanks, Dawn. It's an honor to be here.
Tell us a little bit about yourself.
I'm Wihan Kitshoff, current Ruminant Technical Advisor at Meadow Feeds located in Paarl. Grew up on a farm in the Swartland between Mamasbury and Mariesburg. Graduated from the Stellenbosch University with a degree in animal science and animal production, and thereafter got the opportunity to start with Meadow Feeds.
Today we're talking about the transition cow. In short, can you explain what is meant by that exactly?
When talking about the transition cow, we are referring to the steam-up period, 21 days before calving, the actual calving when the calf is born, and the fresh period of the lactating cow. The cow undergoes a number of metabolic as well as physiological changes within this plus minus 46 days. When a cow is pregnant, nutrients are needed for the maintenance and growth of the uterus, the fetus, the fetal fluids, the placenta, and the uterine tissue, as well as other development. All these factors must be given proper attention, and a different nutritional requirements must be met with the different rations she receives.
Now, Wihan, could you elaborate on the three phases that you've just mentioned?
The first one is the steam up, 21 days before calving. Now, typically a dry period when a cow is not producing milk is around 60 days from the cow's previous lactation to the next. When referring to the steam up period, we are talking about the last 21 days of the dry period, just before calving. After lactation, when the cows are dried up, it takes about 25 to 30 days for the damaged mammary epithelial cells in the udder to renew. Also, the rumen microbial population must migrate from an energy-dense lactation diet that was fed to the cow during lactation to a low-density diet, typically higher in fiber in the dry period. This requires 14 to 21 days for the rumen to properly adjust, and usually ends when the rumen microbes must adapt once again to an intermediate energy prepartum or steam-up diet at around 3 weeks prior to calving as mentioned. During this time, the udder undergoes drastic changes, including the start of milk production, which results in the reactivation and proliferation of milk secretory tissue. During this period of about 21 to 25 days, the udder is highly susceptible to infection.
Now, Wihan, I really didn't understand that there were so many technical aspects. I knew that dairy production was intense, and a lot of farmers tell us that when we talk to them. But how would these infections come about?
As pressure builds up in the udder in preparation for colostrum and milk production, the udder is not being evacuated yet. This causes leakage from quarters, allowing bacteria to penetrate the teat canal and cause infections such as mastitis. The termination of milk production is followed almost immediately by a period of rapid differentiation of the secretory tissue in preparation of the impending lactation as calving approaches. Fetal requirements take precedence over the cow's own requirements for tissue maintenance, as the cow partitions most of her energy and nutrient intake to a growing calf. Besides giving proper attention to diet composition, especially fiber and energy concentrations, I would argue that how we manage the cows and diet allocation are equally important. We could have the best formulated diet with the best ingredients, but if cows do not have access to it, the diet composition would be irrelevant. In growing herds, especially, overcrowding during this critical phase can be a major challenge to cows. Thus, one of the main objectives during this period is not to only focus on diet composition, but also cow comfort in order to maximize dry matter intake.
Wihan, I can see that you're a super expert on this, and I know that there's 2 more phases. What does the next 2 phases involve?
The second one is the actual calving. Now, during this period, the cow's appetite for food decreases dramatically in the last 5 days before calving. Dry matter intake decreases to almost zero in the last 2 days before calving, and the biggest challenge in this period is to get the cow to start eating again as soon as possible after calving. Then the fresh cow, 21 days after calving. The period from birth to 21 days post-calving is called the fresh cow phase and is characterized by a dramatic increase in nutrient requirements such as energy, the urgent need for dry matter intake to increase, and the functionality of the rumen to suddenly ferment an increased amount of starch in the fresh ration. Now, together with practices mentioned before, other practices that can increase dry matter intake and modulate stress are keeping the number of pen movements at the minimum possible to decrease the stress associated with the re-establishment of pen social hierarchy. Many of the practices described may mediate stress and inflammation to some degree. However, there are specific practices around calving that may have a greater effect. It is found that cows that experience a difficult calving had an elevated inflammatory response in the days after calving and subsequently a higher risk of developing diseases compared to cows that have experienced a normal calving. Therefore, timely identification and proper assistance of cows experiencing a difficult calving is critical to decrease inflammation and stress during this time. Thus, the main objective in the fresh period is to supply the cow with the needed nutrition while being in a negative energy balance, but still maximizing milk yield for her following lactation.
Now, Wihan, this sounds like a super sensitive process that needs to be watched very carefully. Let's talk about the feeding. What does the feeding of the transition cow entail?
The steam-up phase is characterized by a gradual decrease in feed intake, as mentioned, while nutrient requirements increase because of a fetus growing inside the cow. During these 3 weeks before calving, the cow is preparing herself to start her next lactation. Without adequate nutrition and management, cows can calve, fade quickly and lose potential income. As said, the fresh cow phase is characterized by a dramatic increase in nutrient requirements, especially energy, the urgent need for dry matter intake to increase and the functionality of the rumen to suddenly ferment an increased amount of starch. The post-calving phase is the most important and vulnerable period for dairy cows as her metabolic needs increase dramatically. Her lactational performance is directly related to how she responds to the high-energy transition period. Typical transition cow diseases such as metritis, retained placenta, ketosis, milk fever, rumen acidosis and mastitis may occur. These health problems usually have a major impact on the cow's lifetime production. However, the impact of the health problems can be drastically limited by the correct feeding and management of the transition cow. Such management also reduces stress and the energy cost of an activated immune response when these challenges occur. Research has shown that the immune system uses an incredible amount of energy when it needs to work at full steam. Thus, lowering the immune challenges of the cow means more energy available for milk production and the restoration of body condition after calving, which in turn means that ovulation resumes earlier and the conception can take place earlier. Now, animal nutrition has advanced dramatically over the last few years in terms of prescribing the nutritional requirements of the transition cow, and modern formulation programs provide for this phase when formulating. Nutritionists and technical advisors can formulate specific calculated rations for both steam-ups and the fresh cow based on their predicted requirements for each specific farm and also say how it must be fed and the predicted dry matter intake of that specific farm or herd. The critical points remain that the farmer must be willing to handle his transition cow separately.
Now, just keeping that in mind, what are the main points when it comes to the transition cow, Wihan?
I can summarize that for you in a few points. The first one is limiting energy intake of the dry cow sufficient just for maintenance to prevent overly fat cows. Feeding anionic salts to the steam-up cow to limit the incidence of milk fever. Increased nutrient concentration when dry matter intake decreases right before calving. To use the same feed ingredients or raw materials that will be used in the lactation ration included in the steam-up ration to support smooth rumen microbial population adaptation to the lactation diet. And the last one, the gradual increase in starch content in the ration from dry cow to lactating cow.
Listen, Wihan, I have a newfound respect for anyone who chooses to step into dairy production. Even your expert knowledge that you're sharing here today, it's definitely valuable for any new farmer. Now, you were talking about the pre and post calving period of a cow. Let's talk specifically around the health. What would you be able to share in terms of formulating the pre and post calving cow's health?
When looking at pre-calving cow health, around 50% of the cows from their second lactation onwards experience subclinical hypocalcemia. Subclinical hypocalcemia has effects beyond just milk fever. It decreases rumen contraction, the dry matter intake of the cow, and neutrophil functions in the dairy cow. It also increases the incidences of metritis, retained fetal membranes, and extra treatment costs. Cows with cationic diets having a positive charge due to high concentration of sodium, potassium, calcium, and magnesium, are more likely to suffer with increased incidences of milk fever or subclinical hypocalcemia. In general, pre-calving diets are basically cationic in nature. One of the main reasons for this is that the feed ingredients used in the close-up diets are fundamentally cationic. Turning your close-up diets from cationic to anionic with coated anionic salts facilitates smoother calving with a reduction in hypocalcemia and associated metabolic disorders, resulting in better cow health, higher peak milk yields, and a better lactation persistency. With regards to post-calving cow health, post-calving cows experience a decline in dry matter intake as mentioned. Due to the low intake, most cows will start lactation in a state of negative energy balance, whereby the energy that they are obtaining from the feed is not enough to maintain good body condition and milk production. This imbalance can result in ketosis. Peak milk production is directly correlated to the fresh period, 0 to 21 days after calving. The total milk produced in the cow's lactation can be maximized by eliminating factors affecting the cow's health in this period.
Could you name and explain a few of the metabolic disorders that was mentioned?
So, most production diseases of dairy cows are usually caused by a high level of production, which is not in balance with nutrient intake or the provision of an inadequate diet, an unsuitable environment, an inappropriate breeding policy, or various combinations of these factors. Although the transition period of 3 weeks pre-calving until 3 weeks post-calving is associated with higher incidences of production diseases, the effects of these diseases on dairy cow health and productivity extend even longer into the following lactation. As stated, the management practices for transition cows must be focused on maximizing dry matter intake and minimizing stress and inflammation. By modulating stress and inflammation after calving, the risk of developing diseases and poor performance may be decreased. Management of the dry cow affects milk production, her subsequent lactations, and most importantly, the incidence of metabolic disorders near, at, or after calving. These disorders include milk fever, ketosis, fatty liver syndrome, retained placenta, displaced abomasum, and a few others. The major metabolic disorders that affect dry cows are usually the result of nutrition and feed management problems.
Could you maybe highlight some of the struggles on a dairy farm with regards to the transition cow?
I'll highlight the most common ones. Metritis. Metritis can shortly be described as inflammation of the inner uterus wall caused by a bacterial infection. It is characterized by abnormal, foul-smelling vaginal discharge, systemic signs of illness with or without fever. It is most often diagnosed with the first 10 days after calving, but some cases may not be noticed immediately without further veterinary inspection. Another one is mastitis. Mastitis is the inflammation of the mammary gland and other tissue and is a major endemic disease of dairy cattle. It usually occurs as an immune response to bacterial invasion of the teat canal by a variety of bacterial sources present on the farm, and can also occur as a result of chemical, mechanical, or thermal injury to the cow's udder.
Now, Wihan, you mentioned something earlier when you were talking about the metabolic instances. You mentioned milk fever. Could you elaborate a little bit more on this one?
Milk fever is one of the most common ones and is a disorder that usually occurs around calving time and is most prevalent in older, high-producing cows. It is caused by a decreased mass in the calcium pool prior to calving and failure of calcium absorption to increase fast enough after the onset of lactation. An animal with this condition exhibits a decreased appetite and an inactive digestive tract. Blood phosphorus levels also drop and blood magnesium levels increase at the same time with this metabolic disorder. The risk of milk fever is reduced if dietary calcium levels can be maintained below 0.5% of dry matter before calving. Sometimes, the milk fever is complicated by toxemia from an infection in the udder, reproductive tract, or the digestive system. Treatment for milk fever may not be successful if the toxemia is not overcome. Calcium glucanate is also the recommended method of treatment for milk fever. It should be administered slowly so as to prevent heart failure. The most likely causes of milk fever are imbalance of calcium, phosphorus, and magnesium, and potassium overload as it relates to anion-cation balance. Milk fever thought to be caused by feeding high levels of calcium from forages such as legumes may have actually been caused by high potassium levels in forages. Many milk fever cases can be eliminated or lessened in severity if dry cow's forages are analyzed and the appropriate grain mix were formulated, especially for minerals and vitamins.
Now, Wihan, you've highlighted a lot about the metabolic disorders. What are some of the struggles on a dairy farm with regards to the transition cow?
The transition cow often does not receive special treatment. She is only part of the dry cow group, which Hubert spoke about, and is brought in to calve shortly before calving, after which she goes straight into the lactation group. This is not the ideal way to handle them. Transition cows should be treated differently and they should be kept separately and also fed a different ration. The dairy farmer who is willing to focus on and invest time and money in this important transition phase can much easier reach the maximum potential of his herd. Extensive research has shown that cows that are managed and fed correctly during this transition phase reach a peak production of about 2.5 liters higher than average and produce about 500 liters of milk more per lactation. Furthermore, the incidences of transitional cow diseases is about 25% lower and days open per cow are also significantly less. However, the dairy farmer must be committed to the following: to keep transition cows separate, provide additional steam up and fresh cow rations, and to appoint or allocate a person to specifically pay attention to the transition animals.
Wihan, could you put into perspective the cost involved when handling the transition cow, as you've mentioned previously?
If you take an average milk price of 6 Rand a litre, feed cost dry matter based of 5 Rand per kilogram and a feed efficiency of 1.3 litres per kilogram. The additional income would be 3,000 Rand per cow. The additional feed cost would be around 1,900 Rand and the extra margin over feed cost would be around 1,000 Rand. Now say the farmer has a herd size of 500 lactating cows, with each cow calving each year. That would mean plus minus around 530,000 Rand higher margin over feed cost per year. Now I know the requirements to properly feed and manage the transition cow includes extra facilities to handle steam up cows and the fresh cows separately, and 2 additional rations, meaning longer mixing times, additional workers, extra fuel cost, etc. And even if the $500,000 is all used for these equipment and requirements, the farmer still has the advantage of better herd health, better reproduction of the cows, higher lifetime production, and be seen as a farm that knows how to look after its animals and act to the best possible interest of his animals. The facilities are also a once-off cost, which can be written off over several years.
Now, Wihan, you've said a lot, and I'm so grateful for your expertise, and I'm sure our farmers listening are too. What are your thoughts in conclusion about the transition cow?
In my opinion, management of transition cows is one of the most important aspects of farm management that will set up dairy cows for success during the lactation period. The main goal of these practices must be maximizing dry matter intake and modulating stress and inflammation. Excellent diet formulation and feed management are critical for decreasing the drop in dry matter intake. However, if cows do not have access to the diet, these practices will be meaningless. Calving monitoring and proper assistance, along with mild anti-inflammatory treatment, can be beneficial to modulate stress and inflammation after calving and decrease the losses associated with diseases during this period. To summarize the top 10 things to do for healthy and productive transition cows: manage macro mineral nutrition of dry cows, control energy intake in both far-off and close-up cows, make sure supplying enough metabolizable protein before calving, get the feeding management right every day, clean and comfortable housing and fresh water, manage social interactions of the animals within the herd, manage heat stress, supply high-quality forage and fermentable diets for fresh cows, and strategically use feed additives. And I know, keeping and feeding the transition cows separate is not always easy or practical on the farm, but it is something through which the dairy farmer can significantly increase his success and also make a positive contribution towards responsible animal production. Professional role players in the livestock industry, such as technical advisors, nutritionists, and dairy consultants, are ready to provide the farmer with technical detail and assistance. The farmer just has to decide to give the transition cow a rightful place on the farm.
Thank you so much, Wihan. It was great to have you with us here on Farmers Inside Track. You were nervous, but you did really well. So thank you so much.
Thanks, Dawn. Thanks for having me.